Simple question then, how safe is our tap water? Should we be worried?
The short answer is no, and welcome to you, new listeners. There's no evidence at all that the tap water is implicated here, and that's really, really important message to get across. The number of cases seen normally in South Africa each year for typhoid is about 100 a year. There's a small increase, and we can talk about why this worries the NICD in terms of the clustering. But in essence, if it had been a municipal water contamination, we would be seeing hundreds, if not thousands, if not tens of thousands of cases. This is just absolutely not the case. And, the clusters we're talking about are clusters of, say, 10 people over a year ago in many cases. It's really not something that we need to be worried about at a municipal level, and there's no reason to worry about the tap water that we're currently drinking, at least regarding to typhoid.
Cluster outbreaks, of course, would then suggest a concentration in whatever part of the country that we might be getting the warnings from. Still, you say nothing to fear there?
Yeah, so the reason why this is really good work from the NICD is that what they did is they were spooling.
Ooh, Dr. Nell, our line just not a bit clear there. We lost you for a little bit. You're saying the reason this is good work from the NICD is?
Sure. It's that we normally see small numbers of cases. They noticed an increase in certain provinces and went and did genetic testing. And what they found is that the bugs that were causing these small clusters, and we're talking about sort of 11 to 16 people, were essentially the same. And what that means is that there's some small degree of human-to-human transmission, and that's not what you want to see. Ideally, you want to see isolated cases where there's no link to other cases because it means there's no onward transmission, whereas what we're seeing now is some small amount of human-to-human transmission. It's unclear why and what that is, and that's certainly something, as I understand it, that they're investigating further. Usually this sort of disease is spread by water that's not of adequate quality or poor sanitation. So it's possible in very complicated small clusters of the country that this is the case, and it's allowing for some transmission.
There was
something to be. Yeah, sorry. Go ahead.
No, go ahead. Please continue. Sorry, I interrupted you.
It's something to note and to investigate further, but it's certainly not a generalized problem, as you'd expect if this was any sort of municipal issue.
There was a concern about Nelson Mandela Bay, the municipality, of course, issuing a notice last night warning residents not to drink tap water in the Eastern Cape's biggest metro.
Yes, I saw that. So that's not linked to any of the typhoid cases, but it certainly is worrying in many other senses. And look, and I think this is one of the concerns with typhoid in general, that this is ultimately typhoid spreading human to human is a sign of really quite dire socioeconomic status. And one of the concerns, obviously, is that if this is, and again, this is not linked to typhoid in the Eastern Cape, but to the degree that the municipalities aren't able to keep the water going, then you start to worry about other diseases. This is not, again, a typhoid issue at the moment, but it's certainly something to keep an eye on. It's certainly very bad timing when you consider the typhoid cases in the news recently.
And I suppose, if nothing else, some of the good that has come from the COVID pandemic is just general hygiene practices and health for many, many people that should keep us a little safer. Dr. Jeremy Nell, appreciate your time.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.